Hello everyone, I'm Dr. Robert Bonakdar. I'm a physician and director of pain management at the Scripps Center for Integrative Medicine, as well as a fellow of the American College of Nutrition. And today I'm going to be presenting on Supplement Smarts, a stepwise approach to choosing wisely when we are considering supplements. These are some of my faculty disclosures here that you have access to. And I want to pay special attention to some of the areas that I'm most interested in that brought me into the realm of dietary supplementation and trying to educate my colleagues and patients on how to use supplements wisely. Since 2000, around the time of my residency in family medicine, I began working with the Natural Medicines Comprehensive Database, which is the largest database of natural products in the United States, and it's really a tool to help physicians guide and counsel patients. As I was doing that, I began working and editing a textbook of herbal medicine called the Herbal Guide, also for clinicians, to improve the level of discussion that patients and physicians have in the clinic, which is an area we're going to be talking about that needs to be optimized. I'm also the director over the last 18 years of the Scripps Natural Supplements Conference, an evidence-based CME course for clinicians to learn more about how supplements may combine and complement traditional and conventional care. And an area that I've been spending more time on recently at the university is teaching a course on this topic to medical students. What we have today is an adaptation of that course for consumers and patients to help improve the dialogue and coordination of supplement care. So, what is the promise and problem with natural products? Well, the promise, as I've learned very clearly throughout my life, having grown up outside the United States where natural products were a big part of mine and my family's healthcare and prevention plan, as well as during a Richter Fellowship in Southeast Asia, where I was able to see how many parts of the world were using various natural products very effectively and traditionally for their entire course of care. As we come into the United States and the Western use of supplements, we're probably more familiar with how natural products are derived into prescription agents, and a number of examples that you see here, things that we're familiar with like aspirin and metformin, which are important parts of our day-to-day treatment regimen, which we use in the clinic and at home. But I think what we're really here to talk about is how to steer clear of the problems with natural products and find that perfect spot where we find an individual optimized use of care. And when I talk about problems with natural products, I'm talking about some research that I did in the early 2000s. This was actually a patient that came to me as a family physician who said that they were very uncomfortable bringing their supplements to their specialty care clinic, but that I would be able to help guide them. So they opened up a box with a number of products, and one of them was this. This is no longer on the market. It's not available, but when I looked at it and what was advertised, I was shocked. And as you can see, it's making promises of treatment, cure, and beyond. So in this case, it made me think about how much more is this happening. I think many clinicians at that time really did not understand the scale or the problem with some of these cure-alls. And when we finished our research, we found that a number of products, especially those that were not manufactured in the United States or being sold online, did not really follow the current laws. And we're really trying to take advantage of desperate customers and patients. So I think while we understand the promise of dietary supplements and natural products, we also need to be very aware of really vetting what we're considering for our use and our family's use and healthcare. So just as a side, as we're going to be talking about avoiding very dangerous supplements, I also want to talk about a somewhat humorous situation that I think we've all been in. And this is called the supplement stare syndrome. You can see this gentleman here probably spent 5 or 10 minutes trying to figure out where he's going to find the right type of supplement. And when he finds the shelf, he might not find one, but probably 12 different versions, and each of them have a different combination, different looking label, et cetera, et cetera. And this supplement stare happens in multiple scenarios, multiple stores, and it's something that at the end of the day is what I'm hoping when we finish our discussion, you will have an ability to avoid as well. So you will know exactly in discussion with your healthcare team what you can take, what you should avoid, where to find it, and hopefully avoid the confusion and lost time in trying to find the right supplement, if it is appropriate. So our goal leads to these questions. Dietary supplements in America, how are they utilized? How are they used? How are they regulated? What's their effectiveness? And how do we optimize use for our day-to-day care? So let's start with basically how are they used? And that goes back to what really are they? So the word dietary supplement really means a supplement that is taken orally. It's something that we ingest that can come in many different forms. That's either a vitamin, a mineral, a herbal or botanical. It can be an amino acid. And I think the product is less of an issue as much as the form, because in many cases when I ask patients initially what supplements they may be on, they may say vitamin D or multivitamin, but when I ask a little bit further, tell me about any bars, smoothies, shakes, teas, I might get, oh, I'm on this Dietary, or I'm on this shake, or I'm on that powder. So all those things can also contain dietary supplements. So a key point here is that when we are having a discussion with our healthcare team, don't just think about the pills in the bottles. Think about all the additional supplemental ways you are trying to improve your healthcare, and mention that when you go into the clinic, so that in some cases those can be guided and optimized as much as possible. And they're really not meant, as the name implies, to replace the diet. They are there to supplement, to be an adjunct, to be a complement to a healthy diet. And we'll talk more about the importance of that a little later on. So the question comes up when a patient comes to me, hey doc, I'm using supplement X, and they throw out a term, and in some cases they expect me or other healthcare providers to be aware of that, or they may ask a family member. The problem with this is that there's over 90,000 different products in the market currently, and this is exponentially growing year by year. So it's really impossible to know everything on the market, versus prescription medications where we have a set list. It still is large, but is nowhere near the tens of thousands we have with supplements. So really what we need to do is look beyond the title. We need to really look at the label, and then within the label, look at what is the evidence for the ingredients. And we'll talk about how to do that as a consumer. How much do Americans spend on dietary supplements? Well, we know it has grown year to year, and it's in the 30 billion range, and is soon going to be $40 billion. And that is one of the largest out-of-pocket expenditures that Americans make. So Americans really believe in the potential of supplements to the point that they're spending this amount of money, and we want to make sure that money is spent wisely, and we'll talk about that as well. Over the years, just like spending has increased, so has the level of utilization. So we see on the far left in the late 2010s, we had 30 to 40% use, with differences in age groups, men and women. And as we get closer to the current times, we have over 50% of the population utilizing, and in some cases close to 70 to 80%. If we look a little bit deeper into these numbers, we can see that this differs by male versus female, with, again, women, like many aspects of healthcare, especially holistic healthcare, being utilized more by women than men. And in cases where we're looking at all aspects of care, women tend to utilize that more, especially preventative care. We see that as Americans age, they tend to use more dietary supplements, but overall, we are continuing to increase our use of supplements and spending more on them. If we look at the typical dietary supplement user, and we try to go a little bit deeper beyond male, female, we also see that education makes a big difference. And this also impacts many other choices in healthcare. When folks have a higher level of education, typically they are self-choosing where they go, who they see, what kind of care they're going to get. So that's also happening with dietary supplements. That is not surprising. We also know that certain ethnic groups who have maybe more of a tradition in their family of using dietary supplements have a higher level of use. And when we get to health status, it's actually a very interesting phenomenon. We have a group that you might be calling the worried well, folks who are doing everything right for their health care. They're eating right, they're not smoking, they're not drinking, they're exercising, and at the same time they're adding a supplement as an additional insurance policy. On the other side of the spectrum, we have folks who may have chronic illness. They may have chronic arthritis, they may have recovered from a recent medical episode, and they're really trying to optimize their care. They may also feel like their current care, whether it's a medication or other treatment, is not quite doing enough, or may have more side effects than they like, and they're looking at natural therapies. In some cases, that's a wise choice. In other cases, it can be a dangerous choice, and we'll talk about that when we review the case later in the presentation. So when we talk about the large level of dietary supplements, the $30+ billion and the 90,000 products, what are the most common types of products that patients are utilizing? Well, across every age group, every demographic, multivitamins tend to be the most common. We have at least 30 or 40% use. In some cases, more than half the population in that group is using a supplement, is using a multivitamin. In addition to that, we know that in some of the named vitamins, such as vitamin D, vitamin B12, get a lot of use. And beyond that, it really depends on individualized issues, and those are what we call specialty supplements, which we'll talk about next. When we talk about the specialty supplements, they go beyond the named vitamins, and we're really talking about things like botanicals, your turmeric, your ginger, and as probiotics, and things that patients might be using for a specific health condition or a specific health concern, where they're trying to either supplement what they're using conventionally with their doctor or trying to do something before they go on to conventional care. And we'll talk about how to balance that out as well. The key point with this is that these numbers, especially the lower items, 7, 8, 9, 10, and beyond, tend to shift year by year. And that is dependent on advertising. It's dependent on research studies that come out either positive or negative, that either tells people that this is more of a better idea to use or something to avoid. And we see that all the time with supplements. So this will shift year to year. But the thing to keep in mind is that multivitamins, as well as some of the key named vitamins, like letter vitamins, D, K, C, etc., B vitamins tend to be in the top 5. When we talk about the motivation to use dietary supplements, we talked a little bit about a health condition, we talked a little bit about other demographics, but when we look at male and female use of dietary supplements, what's key is both groups are really trying to improve and or maintain their health. In addition to that, there are specific groups within this population that are trying to reduce nutritional shortfalls or deficiencies, which I think is actually a wise area. That's about a quarter of the population. And for women, there are concerns about bone health. For men, it's cardiovascular, heart health, energy, and performance. So those are some of the key things to keep in mind. We'll come back to how to connect those condition concerns with actual products. Now, how often do we discuss and document dietary supplements? If I were to say there's one area that we need to focus on more and more as we progress in our dialogue with patients and healthcare providers and family and friends, is how can we get everything on the same page? In many cases, supplements tend to be fragmented with conventional care, and we're trying to change that. This is some data that shows that when a supplement is discussed, it's only about half the time. In some studies, it's about 30% of the time. And when a supplement is discussed about half the time, only about a third of the total number of supplements is discussed. And this goes back to what one of the initial slides which said, in some cases, we may be, as a patient, comfortable or aware to mention the multivitamin or vitamin D, but we don't think about the tea, the bar, the powders, and the other meal replacements that might be part of a supplement picture that should be on our medication list and something that we have to mesh with our medications. Beyond that, when we do mention it, it is only getting into the medical chart about a quarter to a third of the time. So leaving the majority of what Americans are using out of the purview of what we should be, again, reviewing and making sure is safe and effective. And most importantly, I would say beyond all this, there's very little discussion of effectiveness, meaning is it worthy of continuing or not continuing based on the evidence? That only happens about 16% of the time. So a lot of work to be done, and we'll talk about that. One of the reasons, and there's been a lot of discussion of why there's so little back and forth and dialogue in the healthcare setting. When we talk to patients about this, one of the key things that comes up is that there's a lot of confidence. Because these are seen as food products or natural products, which may or may not be true as far as their actual safety, the perception is they're very safe and not even necessary to bring up in the medical setting, which I would argue is absolutely not the case. But as far as the polling showed, about 70% thought very safe, additional 14 thought extremely safe. So again, not, in their minds, not something to discuss, and we'll talk about why it's important to discuss that. So when we boil it all down to why it's not discussed, it really comes down to a don't ask, don't tell, which is unfortunate. Physicians often don't ask for many reasons that we'll talk about next. And as we've talked about, patients don't often feel comfortable or see the need to discuss. For physicians, on the other side, we know that their knowledge or comfort with the topic, which is not a topic that's taught in medical schools, and going back to one of the reasons that I work with medical students and medical trainees, is to increase the knowledge and confidence scores, because those directly correlate with how often a physician or a clinician asks about supplements. So if the knowledge and confidence is not there, it's going to be very uncomfortable of a discussion, and in many cases doesn't happen. And again, the patient gets the signal, well, if I didn't have that discussion at this visit, I probably don't need to have it at the next visit. And each visit is very important to have some either brief or extended discussion depending on the level of use. So to put our first category, the pattern of use, to summary, I would say we have a high level of formulations on the market. We have a high level of confidence, especially by consumers, on the safety and efficacy of these products. We have a high amount of spending and use of these products, while at the same time we have very low levels of knowledge, discussion, and documentation, which is unfortunate. We need to find a better balance, and we'll talk about that, how to get there. So the second category is, how are these products regulated? And I think one of the key things that we know is that many patients really are aware that supplements are regulated differently than medications, but not exactly what that means as far as their safety. So when you look at the FDA website, when you look at the Office of Dietary Supplements, it's very clearly stated that the FDA, which regulates and approves our prescription medications, is hands-off, at least initially, with any type of approval for dietary supplements. If the supplement is already on the market, your fish oils, your glucosamines, your named vitamins, they are not going to approve a new product, a new label of those 90,000 that's about to come on the market. So all of the hope in regulation really sits on the manufacturer, which makes it very important to vet the manufacturer, and we'll talk about some ways to do that as well. So if you really look at the balance of regulation for dietary supplements, it comes down to the 1994 DSHEA Act, the Dietary Supplement Health and Education Act, which basically created a subcategory within foods for dietary supplements. Within foods, there is some additional regulation, but it's very different than the typical prescription medication that needs to be approved for a specific cause, such as a cholesterol medication being approved for lowering cholesterol. It cannot be used for other things, at least from an advertising standpoint, by the manufacturer. Supplements, it's very different. How they are advertised and how they're used simply states that they cannot be used for the prevention or treatment of a condition. So in many cases, what you will have is a product that really we as a consumer need to understand, what is this really used for? What is the evidence for its benefit? And going beyond testimonials, going beyond what our neighbors and our friends think about the supplement, is what is the evidence? And we'll talk about some sites that can help with that. So balancing this out, the manufacturer really needs to work on making sure that it's made in a clean facility, the label is indicative of what's actually in the bottle, and they're compliant with the good manufacturing practices that are out there. This is, for the most part, something that is not consistent across the board, and we'll talk about that. What I do want to mention is that the FDA does have the ability to enforce when there's errors and misadvertising or inappropriate claims. And they can send warning letters, and we saw that a lot during COVID with products that were claiming all types of medical cures and things that were not appropriate. We also have other products which long-term have talked about treatment and cure of other medical conditions, including cardiovascular conditions, cancer. And beyond that, the FDA can also enact recalls. We remember recalls with ephedra and other products that were dangerous. There's also recalls when dietary supplements contain adulterated products, meaning they're coming typically from abroad and they contain some types of pharmaceutical agents, even though they're not supposed to. And again, those recalls can happen, and they typically tend to happen with products that are trying to make large promises with weight loss, performance, sexual enhancement, those products which I absolutely talk to my patients about avoiding because they're more likely to be in this category. There's always been a debate since the passage of the 1994 DSHEA Act. Do we need more regulation? And I think this is an ongoing debate of how to optimize it while still taking supplements and not putting them right on top of prescription agents. So is there another category? Can that category be optimized? The answer is yes, and that's an ongoing debate. So I want to talk about beyond regulation, how do we as consumers really make sure that we're using a supplement that's effective and that's safe? The regulation will likely be a continuing debate, so we really need to do our own homework before we take a supplement to make sure that it's right for our healthcare. And so how do we make sure that it's going to help us? I think there are examples that we may be familiar with dietary supplements that are evidence-based. That means large bodies have put out recommendations or guidelines, such as folic acid in pregnant in women of childbearing age to prevent neural tube defects, omega-3s by the American Heart Association for reduction of high triglycerides, magnesium and riboflavin in the setting of migraine is in guidelines. We have some guidelines that talk about melatonin for jet lag, probiotics in certain severe gastrointestinal conditions, inflammatory bowel disease, etc. And vitamin B12, for example, there is guidelines that over the age of 50, due to difficulty with absorption, that Americans should be looking at supplemental forms of B12 versus non-supplemental forms. So I think those are all key things to keep in mind. There are evidence-based supplements. What's really important is the details, meaning if a woman is going to be using folic acid, to make sure that it's the appropriate dose. It's not too high, it's not too low, because there can be dangers with too much folic acid. We also have fortified foods, which need to be kept in mind when we're talking about supplementing with an additional pill or prenatal vitamin to make sure that that's an appropriate dose. With omega-3s, similarly, if we're trying to actually use it for the evidence-based indication, we need to have an appropriate amount of dose, in this case 2 to 3 grams, to get an effective result. Beyond that, I think it's really important to look at what are the individual needs that you may be experiencing. And I think a lot of this comes in the setting of supplements. In my practice, I talk a lot about, is there an area of deficiency or insufficiency, maybe not quite optimized levels, and can that be affecting medical conditions or other factors? So we're going to talk about 3 categories of deficiency. And the first one is with medical conditions, then medications and diet. So what do I mean by deficiency related to conditions? So we do know that certain medical conditions are linked to certain nutrients being suboptimal. And this is, in some cases, a two-way street. So in some cases, having a lowering effect of a lower amount of, let's say, B12 can accentuate neuropathy. With ongoing neuropathy, that may be linked to things like diabetes and use of diabetes medication. You can also have a lowering of the B12 level. So it can be a vicious cycle. But if there is a chronic condition that patient is coming into the clinic with, or you are experiencing, it's important to look at, can that be linked to a deficiency such as with vitamin D or calcium in the setting of chronic pain, vitamin D and calcium osteoporosis. And you see the list here of the things that can be connected to certain conditions or surgeries such as bariatric surgery or other conditions that affect our gastrointestinal tract and affect absorption. I also like to talk to patients about drug nutrient depletion, which is not an area that many folks are really familiar with, but I think it can be really impactful when we look at patients who may be on a number of medications for chronic disease. Those medications can affect the levels of key nutrients. And you have this chart here. I'm not going to go through it here, but you will have this resource available to you, as well as a website where you can put in your medications and look at what nutrients might be at risk for deficiency. The last area I think is really important to keep in mind, because we talk about reducing deficiency related to intake. Well, it can be a very confusing arena, or maybe kind of a head scratcher, because the intake of food in America is in many cases excessive. We know that we have an obesity epidemic, we have a high intake of added sugars and added calories. So how can we actually be deficient in anything? Well, I think what we need to look at is not what we are consuming in excess, but what we are missing in our diet, which tends to be especially fresh fruits and vegetables. And when we look at the data of what is actually on the American plate, we know that about 60% is processed or ultra processed, which means it's very depleted of the typical vitamins, minerals, nutrients, fiber that are really important to help with chronic disease management. Only about a third of the diet is not processed. So I think in many cases we're also seeing that ultra processed diet over time can begin to deplete some of the key nutrients. And how often does this happen? Just to keep in mind, only about 10%, 1 in 10 Americans gets the adequate amounts of fruits and vegetables, which typically is two fruits, 3 vegetables, and that's a minimum. Only about 10% of the American population is reaching that. In some studies, when we look at populations that are having that deficit in their diet, at least a third of them have a deficiency in 1 or more nutrients. So if we are talking about someone who has an optimized diet, which is not this picture, then we may be having a different discussion about the need for dietary supplements. But if we're talking about the typical American diet, the US plate, we are typically talking about folks who are either insufficient or deficient in 1 or more nutrients. Another study at the Linus Pauling Institute, University of Oregon, found that if we look at a number of other nutrients and we're looking at specific areas of not adequate intake, we can actually reach high levels if we're not supplementing. Meaning, if we take what's in food and we add what is in fortified foods, such as breads and cereals, we can still have a shortfall if we are not getting adequate amounts of fresh fruits and vegetables. And this is a list that's important in some of the conditions we're going to be talking about. One key example that I think is one of the most significant deficiencies that's happening in many Americans is that of magnesium. About 70% of the American population is not consuming the recommended dietary amount of magnesium, and about 20% is not even getting half of that amount. And what does that do? It causes, in many cases, inflammation. It changes how our muscles work because we know magnesium is important in every cell of our body. So again, if we're talking about a nutrient that we need everywhere, that about 70% of the time we're not getting enough of, it's understandable that it can go on to cause some issues. So the first question I would ask as you're considering supplement is, how good is your diet? Are you getting enough fresh fruits and vegetables, enough whole grains, legumes, and how low is it in some of the other areas which may be going towards a inflammatory potential, such as red meat, alcohol, added sugars, and sweets? The question that also comes up is, well, can I just take a multivitamin? And can't that make up the shortfall? Well, the answer is it depends. And we need to look at how healthy the diet is, which is what we're looking at on the bottom of the screen, and whether or not we are taking a multivitamin or not. In many cases, if we are already taking a healthy diet and we're doing all the right things, which is kind of sort of the subcategory that we talked about of the population that may need it less, there's less likely of a benefit from the multivitamin versus those who have an unhealthier diet, who are not getting the adequate nutrition like magnesium and some of the areas that we talked about, then it may make sense. And this is an individualized discussion that may be appropriate to look at when a supplement like a multivitamin is important and when it's not. We'll come back in our case to discuss that as well. So the effectiveness summary is that we have a small number of supplements which are in evidence-based guidelines. More commonly, what is effective depends really on individual factors such as your condition, your medications, and your background diet. What is safe and effective for one person may not be for another person, and this is really what makes the review of those products so important. And that's really what we're going to spend most of the time on, is how to optimize use. This is a brochure that was part of the Herbal Guide, the textbook that I mentioned earlier, that really we use in our clinic as a way to make patients comfortable in discussion. I would say whether or not you are comfortable in your clinical setting when you see your doctor, it's still incredibly important to discuss all supplements you are taking or considering, even if it's not related to the condition you're being seen for. And this is just an example of a way that a clinic can help a patient feel more comfortable, but it also emphasizes that the more we know as healthcare providers, the more we are able to advocate, guide, and help come up with the right decisions. So I'm going to use a case to exemplify how to approach this scenario. So this is Greg. He's a 53-year-old male. He's been having issues with borderline diabetes, some elevated triglycerides in his cholesterol labs. He's beginning to have some tingling in his feet, which is mild. He's had a long-term issue with depression, which right now is controlled but not optimal. And he has some GI symptoms like reflux, constipation, which he calls annoying. His vitals are okay, no high blood pressure, but his weight is borderline. He's been given metformin for his prediabetes, duloxetine for his depression and neuropathy, and he takes occasional acid blockers. He has been told to take a multivitamin, but he is not very good about that. So his diet, he's a blue-collar worker. He kind of grabs and eats on the go. He's not really does not pay much attention to his diet. He's very active with his job and outside of work. Social life is great. His goals when he comes in is on his yearly physical is to really figure out how he can stop the progression. He's seeing the weight go up, he's seeing the blood sugars go up, and the triglycerides. What can I do? Greg asks you. But he also asks about supplements because you bring it out. Are you using any supplements? He mentions sometimes multivitamin. And then you ask, what else are you considering? And he says, well, I've been considering a fish oil because I think it can really help bring down my cholesterol, and I don't need to worry about my diet. Is that correct? He also asked about St. John's wort because he's heard that it may help his depression. So I like to use the framework of the herbal mnemonic, and we'll go through this step by step, but it stands for hearing the patient out or hearing each other out, and going from that step to additional steps to really figure out how to educate, evaluate, record, be aware, and go on with what's needed next to really optimize care. So we'll go through this step by step. When we hear each other out, Greg is really, not sure about supplements, but he brought them out in our discussion, and we need to thank him for that. And every time you bring it up in a clinic, you're setting a new example for, I think, the dialogue that needs to happen in every clinic visit. So we thank him for that, tell him we're available, even not during a visit, maybe if he has a question offline to let me or my nurses know so we can help guide that decision. I'll let him know that in general, we like to start with diet. Diet makes the most sense before we add supplements, and also that we are going to look at some potential areas of concern with some of the medications and some of his symptoms that we can hopefully optimize. So with that, I always like to start with diet. And the reason for that is we have very good evidence before we go on to checking interactions and going into the supplements. The diet has a profound ability to help. So this is a study looking at a large number of middle-aged populations that were looking at what are the keys for ideal aging. What are the dietary patterns that help us prevent and reduce some of the conditions of aging that Greg is beginning to experience. So we did a Western diet, which is the one that we showed before, which is high in refined sugars and foods, processed foods, red meat, high fat, saturated fat, inflammatory fats, can have a significant impact on the progression of those conditions. The odds in this study of a non-ideal aging with this diet were that it would increase chronic disease, increase heart disease, heart attacks, cognitive, physical, and mental decline. So all the things that he came in to try to avoid. So what we tell him is that in addition to switching his diet, helping with some of the metabolic issues that he's really tackling on the labs, it can also potentially have some benefit in across the board areas that he is seeing symptoms but not necessarily making connections, such as depression, his neuropathy, and even his stomach symptoms, which may be linked to the diet. His second question is, well, Doc, can't I just take a fish oil and be done with it? Unfortunately, the evidence is it's not that simple. This is one of a number of studies that I think did a really good job. What they took is a Western diet, which I just showed you, as well as an anti-inflammatory diet full of fruits and vegetables, and they added a fish oil or a placebo to that. So basically, if you take a placebo plus a Western diet, you expect a progression. That's the top curve. If you add a fish oil to that, you may get a little tempering. So it's not going to go high as fast, maybe a slight improvement, but really you get the benefit when you take the fish oil and add it onto a healthy diet. And when you do that in the third curve for a few months, you get, in this case, a reduction of medication requirement. And if you take it for 6 to 8 months, you get more of a reduction in the need for medication. So I think the combination always works best. And when we are able to optimize diet before starting a supplement, we have the perfect duo. We also spend time educating him on potential positive combinations. So we often talk about the combination having issues, having a negative side effect. In this case, we can tell him that if you use folic acid, on top of your antidepressant, the evidence is pretty strong that you get a third or more additional benefit. So those are some of the key things to keep in mind. We also look at his medications and realize that a number of the acid blockers and the metformin can have an impact on some of the nutrients that may be behind his symptoms, the deficiency of those nutrients. So we run some labs, and as we expected, his B12 is not optimal. It's at 220. We want it to be over 400. Vitamin D is borderline low. His magnesium is also not abnormally low, but insufficient. Zinc is okay. We were worried about that, but that's fine. And his triglycerides also do need some work, which we already know. So we look at his recommendations, and we know he's on the metformin and the medications at the top, including the acid blockers. And we say, okay, Greg, we'd like you to start folate and B12. And in this case, we were able to find a combination to reduce the number of pills. And we also were able to find a combination of magnesium and vitamin D at low dose, which should help increase his numbers. At the same time, we are going to ask him, as part of his dietary plan, which hopefully will reduce some of his reflux symptoms, to try to reduce use of those acid blockers, which we know also reduce the ability to absorb some of the key nutrients that he needs to maximally prevent the progression of his diabetes. The area that we really need to focus on is his desire to use St. John's wort, which he may not be aware can interact with his medications. And in this case, we show him two databases which are free. This one is drugs.com, which causes a red flag when you put those two combinations together. And another one is through WebMD. Again, you will have the resources available, so you can run the same link. And this resource I like because not only does it have an interaction checker, but it has a section on facts related to various dietary supplements. So the next step is really to agree over the next 12 weeks that he's going to follow a diet, work with a dietitian, and come back to see us in the next quarter, which he does. He repeats his labs, and before we look at the labs, he's able to tell us that he's able to lose some weight. His nerve pain is not as significant, still there, but most importantly, his stomach symptoms are much reduced, and he hasn't really needed the acid blockers, which he's very happy about. His mood seems to be better overall. He's not sure exactly why, but overall he's doing better. And when we look at labs, all of them are trending in the right direction, so we can actually reduce some of his supplement so that he can continue to reduce his pill burden. So I think the next thing is we really need to learn. So we've agreed to discuss, and the learning process here is that Greg and patients in general often do not realize the power of diet before they go to the supplement, because supplements are touted, they're part of a $40 billion industry, but diet sometimes does not get the attention it deserves. So he has learned that it can be very helpful. He's also realized that it can be very helpful in reducing some of his symptoms, not just giving him a better outlook or better weight. And he also knows that he can check some of these supplements he may be considering adding to his regimen before he comes to see us. So he has a way to really vet it before he comes to us, but we're available, as all healthcare teams should be, to help him with any areas that may be complex for the next visit. So we've learned also that we can optimize his medications and supplements. We can reduce some of his medications, which is always a good idea, and really give some other areas of consideration when we have room to add to optimize at the next level. So when we look at his new plan, we're able to reduce some of his medications, which again, because of his better diet, are not needed. We may be able to reduce his antidepressant, which is one of our goals, and we are able to reduce one of his supplements to a half dose because he's doing well with his blood numbers. So his final recommendations actually are quite easy to follow and are no more significant number of pills than he was before, and over time, he's not dealing with the deficiencies. We're going to hold off on adding anything like omega-3s because we're hoping that with additional time with the diet that those things will also optimize, because again, we call diet slow medicine because often it takes 3 months, 6 months, and we really need to give it a full advantage. So in the last section here, we're going to be talking about what does this plan look like for me? And I would say we look at the same herbal mnemonic for how it would look for you. And we start with diet. So I come down to 3 basic questions about whether or not you need a supplement. Number 1, how is my diet? Can it be optimized? And if you are not having the 5 fruits and vegetables per day, you're having a lot of added sugars, that's a great place to start. Work with a dietary expert, talk to your healthcare team to really put that into place. And I think what the second question, based on that first question, is what supplements am I considering? And in many cases, these do not need to happen at different times. You can optimize your diet while you're considering supplements, while you are vetting them, while you are checking out their labels, you're putting them into the databases that you're going to have access to make sure they are safe and potentially effective. And then able to take those as step number 3, have I discussed them with my healthcare team, the folks that will really kind of help me combine it with my overall care. And if you have not done that, this is a really key step, because in many cases, like the St. John's wort or additional supplement that may not be needed, may not be dangerous, but may not be needed, this is where those things can get optimized. So just to look at a few resources as we finish up, the Office of Dietary Supplements, which is one of the resources you're going to have in your resource sheet, has a plethora of fact sheets on various supplements, also talks about how to read labels, how to optimize, how to discuss with your healthcare team. There are also a number of independent testing and verification labels that I would highly recommend being familiar with. The USP and NSF are probably the two most common. What's important here is that not only does the appearance of these on a label tell you that these are made in a facility that's clean and well regulated. Again, both of these are voluntary, so not all vitamin bottles will have this. But if they do have it, it means they're going above and beyond, and that's a good sign to keep in mind. Most of the time they don't have both, but at least one of these is a good starting point. Then when you go into the actual label, look at the ingredients, make sure that the ingredients make sense. There's something you're familiar with. If you're not, again, you can look them up, because some of these supplements can have not 1 or 2, but maybe 10 or 12 different supplements, and the first 10 are perfect for you, but the other ones may be a contraindication or a reason for you not to combine it. So be familiar with these label verifications and look for them on your label. There's a number of great handouts which I would recommend for further reading about how to go to the next step, how to have that crucial conversation with your healthcare team to make sure something is just right for you, just like it was for Greg. There's also great websites for putting all the supplements you're on or the ones you're considering, so when you are going to your healthcare visit, you're ready to discuss them fully. So when we summarize, what do we know about supplements? What have we learned? Well, we know that they're very commonly utilized. They are not commonly discussed and documented. And they do not typically replace a healthy diet. And they should not be seen as so. They are only a supplement or complement to a healthy diet, which is probably the area we need to spend the most time on. But I would say individually, dietary supplements can be a very helpful part for supporting aspects of chronic disease management, especially when they are linked to deficiency or nutrient shortfalls. And finally, we really want to encourage an open communication, dialogue, and reevaluation to optimize care, and most importantly, help you on your day-to-day basis to avoid the supplement stare. And with that, I thank you for your attention today. Thank you and good luck.